Thank you so much, Dr. Raman. If we can get everybody to turn their cameras on, we have some incredibly great questions coming in. I think that what we were just speaking about with diet and with exercise really resonates so much with people watching, from both healthcare practitioners to people with lived experience. So again, thank you to all three of you. That was fascinating. I think that it really does talk about the fact that, complex chronic illnesses and diseases need so much more than a simple biomedical model. And to hear an internist telling us all that is even better. It warms my heart to hear that. So thank you so much for all three of you being here. The first question, we're going to jump right into it. Someone wanted their perspective from Dr. Packham on context and whether areas of allodynia and hypoesthesia or even hyperesthesia are context dependent and context driven.
Ooh, what a great question. So it's so interesting. I don't know that there's any research on that. Certainly one of the things that we looked at, because we actually did some reliability and validity testing on methods of measuring allodynia. And one of the things that was interesting was we didn't see big changes in allodynia related to repeat testing. So when we did retest on the same occasion, and we kind of expected that with repeated testing, that we would actually see an increase in allodynia because people had been there a long time and they were getting more tired and they'd done a bunch of things and had a bunch of people poke them. And we actually were pleasantly surprised at how good the reliability was for retest. But what was interesting was when we looked at on the same occasion, right? So, which was really kind of, let me put that was inter-rater, so between two different things. When we looked at retest a week apart by the same person, the reliability wasn't quite as good. So it was interesting to us to say, so even though the same person was doing the testing, it wasn't as consistent as what we were seeing when two different people did it on the same day, which really would have shared that same context. So that maybe hints that there maybe is some context dependent pieces. But I think just from listening to my clients over the years, I would say that context is huge, right? It's influenced by the environment. We know that people, who come in and they've just fought traffic and then had to fight their way through hospital hallways and find a parking spot and all those things, that often they come on and they are in fight or flight, and we would expect that we see greater sensitivity if we were to measure it at that moment than we would at a different time. So I really think that's, though, an exciting part, because that's a way in for us to change things as well. If we can recognize that context plays a role, then that's a way in for us to start to think about how do we control that and how can we use that to actually build skills in managing things.
Yeah, fantastic answer. I think anecdotally, we definitely see it. Shelly, I'm curious on your end, when you are seeing patients come in and they're doing their exercising and their yoga, how context and what's going on in their life affects performance and what they're doing working with you.
Yeah, thanks. I mean, it does. I don't have any, research or anything to really measure that or to answer that, but I mean, it does. And I think I also want to add, other than just the obvious that we see, like the person's physiological state and what they're going through. So it could be, like you talked about, like, let's say they were stuck in traffic or something's going on in their life. So we think of that sometimes, but then we can also think of other things like our relationship with them. So, what's going on in my own physiological state as the healthcare provider, and how is that affecting the person in front of me too? So that's, I just wanted to, that came to my mind as talking about context dependent. And, there are times in my life, and it could be, sort of a season or a few weeks or something going on in my life, or it could be just that day, but I can even see changes within that person based on how I'm feeling and how I'm doing. And I think that's, really important too. So I don't know if that answered the question. I guess the short answer is yes, it's context dependent. And even things like, I'm just trying to think of some other, maybe aspects that aren't obvious to people, like temperature of the room. Of course, language matters. We know that. Also could be our facial expressions and our tone of voice. And some of us here may have heard of Stephen Porges and polyvagal theory, and looking at our social engagement system and what sorts of things make us feel shut down and what sorts of things make us feel more safe and engaged. And that could be things like the tone of the voice and sound and facial expressions. And so that's maybe a bit rambling, but I hope that answered what you were asking.
Absolutely. And Maitreyi, I don't know if there's ever been a study on pre-medical student examinations and lineups to bathrooms, but certainly we know that significant increases in stress can lead to diarrhea and irritable bowel symptoms. I'm wondering if you know of if there's data looking at this and, using yoga to try to stabilize and build resilience there.
Yeah, that's a great observation and comment. It's also a focus of our PhD students' thesis. She's looking at two modalities of yoga delivery, especially in the COVID pandemic, on outcomes in irritable bowel syndrome. Certainly the pathophysiology of IBS and the relationship between the central nervous system, autonomic nervous system, enteric nervous system, and the gut are really well established. And patients do tell us about how their GI symptoms are exacerbated in the context of stress. There have been 4 randomized control trials looking at various different types of yoga and yoga interventions in the management of IBS, all of with very positive outcomes. I think, as Shelly spoke about previously, the large gaps are more around what is the dose, what is the frequency, what are the types of yoga. Those are all big unanswered questions that I think further clarity in that field will help us better understand how to develop a prescription for yoga.
Yeah, we need that research dollars to keep flying in, and we need people such as yourselves to continue to fill out those grant applications and keep pushing towards this. Kind of following up on that and speaking about the gut biome, there was a few different presentations over the weekend that brought up the biome and brought up diet. One of the questions came out, which I thought was quite fascinating, about the possibility of actual bacterial links inside of the brain. For many years, and maybe even still most of us today, would suggest that the brain is a sterile environment. Yet in the Society for Neuroscience in 2018, there was a fascinating poster that probably stole the show, finding bacteria living in myelin sheath that matched similar bacteria that were growing in the biome of the gut. I'm curious what you know, or if you could comment on the gut brain. Sorry, that caught me with a tongue twister. Connection, but also, your thoughts of not just the connection, but just how intertwined they really are.
That's a really interesting question. I'm certainly not an expert at all about bacteria in the brain, and that's something I'm less familiar with. I think what's very interesting, I've heard experts in the field of IBD suggest that that treatment of mental health related concerns, in fact, may improve the the prevalence of or incidence of new onset cases of IBD, and also treatment of anxiety and depression independent of treatment of the gut may also improve inflammatory markers in the gut. So I think that evolving perspective is really interesting, and I think there's a lot to be said of independent treatment of brain-based conditions. But beyond that, I couldn't really speculate or have much to offer in terms of specifically the brain biome, if you will, outside of the brain-gut connection.
Fair enough. I won't throw that at you guys. It's an interesting finding that's never been replicated, but it could have been so many different variables, but quite fascinating. So bringing it back to Shelly, and I'd love to hear your guys' comments as well. A lot of people struggle with physical disabilities, and trying to do yoga can sometimes be very difficult. Sometimes it's positions of having the head below the legs. Sometimes it's inflexibility. Sometimes it's that feeling of walking into a studio and feeling like maybe I just don't quite belong in this place. This looks like a lot of really fit young individuals, and I'm just trying to learn how to move. I know that's a very stacked question. I've been stacking questions all weekend. I apologize, but maybe we'll start with you, Shelly. What do you suggest to someone who's just wanting to learn and start the process and feel comfortable in doing it?
Yeah, thanks for that question. So the first thing is just reminding yourself that really yoga is this practice, like I talked about, that it's breathing and it's connecting with yourself, and movement is part of it, and it's movement that is accessible for yourself. So it is unfortunate that, although it's nice that yoga has come to our culture in our time, but it's unfortunate that yoga is associated with these, maybe studios and acrobatics and going upside down. And so that's, what I would say is that you do have to do a little bit of investigation. So whoever had asked that question, or anyone listening, is you have to start looking, maybe it's Googling, and you have to find different yoga studios or classes or professionals in your area. And then you have to ask questions. So sometimes just even a phone call, sometimes going to the studio is helpful. Of course, in these days, it's probably more a phone call, and just, and saying exactly what, the question was. So framing it as, I'm a little bit intimidated, or I have some issues, or I have some precautions, or I'm not very flexible. And you will get a sense when you talk to the professional on the phone as to how accessible and inclusive their practices are and what their training is. So that's, and like I said also in my talk, unfortunately, there's no one best link, because even within the Yoga Alliance, if you look at people who are registered as yoga teachers, everybody has different continuing education training. So there's really no way of knowing. So I guess to sum that up, I would say phone the professionals in your area. Of course, nowadays things are online, so you can even find perhaps a class online, take it with anybody in the world. You can look to, I'm going to give you 2 sites. So you can look to Accessible Yoga. I don't know if it's .com, but if you just Google accessible yoga, you will come up with some great information about people who teach yoga that is more accessible. And then also the iayt.org has a directory of yoga therapists who can make yoga more accessible for if you can breathe, you can do yoga, is what we say. And then of course, I am going to put this out there to contact me. I can, like I said, direct you to people who know people in your area, or nowadays the online practices are accessible around the world. And we do have, I will plug some video practices that we have. So myself and Neil Pearson have practices that are Overcome Pain with Gentle Yoga, and they're on Vimeo, online, accessible. And he does everything in a chair, and they're gentle and not going upside down and things like that. And I'll maybe stop there, but there's a lot of different resources out there. Thank you.
Perfect. Thank you, Shelly. And, you know, obviously this fits directly into individuals with allodynia and CRPS. Desensitization is one thing. Trying to get into any sort of excessive exercise can be quite difficult. What kind of exercises would you suggest, and movements and areas that people who initially are struggling with CRPS and haven't figured this out, what would you make those suggestions for, Tara?
Thanks. So I actually was smiling as I was listening to Shelly talk, because that is absolutely one of the places that I would start, would be breathing practice and body scans. So where people can become mindful of even the patterns of what they're experiencing, and be able to recognize it without the threat, right? So that idea of a mindful practice and a body scan. So that's always a great place to start. And in fact, for the short term, from a somatosensory rehabilitation point of view, we're talking about how do we settle things down? How do we not poke the angry dog with a big stick, right? How do we avoid that, but still give the person the opportunity to engage in activity and movement that starts to give them mastery, and starts to help reduce their symptoms? And so it absolutely, things like yoga can be a great way of doing that. And so, yes, helping people to recognize, so maybe starting with imagery and breathing exercises and that type of thing, and then be able to say, do you know that that's yoga, right? Is sometimes a great place to give people entree into that. But certainly also just identifying, what are those meaningful activities for the person, right? That's the OT talking, right? What are the purposeful, meaningful activities? What are the things that Marie Kondo your exercise, right? What gives and doesn't take?
Thank you so much. That's goes back to treating the person, and working with the person to find what works for them, rather than, handing a pamphlet over and go do this. So I do appreciate that. Dr. Raman, really good question about food and diet. Some believe tomatoes are pro-inflammatory, yet they're part of the Mediterranean diet. What are your thoughts regarding finding balance in a diet and how to move forward for those individuals?
Right. So one thing I didn't touch on today is that the evolving science of metabolomics would suggest that when you look at the metabolites of food consumed, we're actually eating more than just the food. So there's this concept of xenobiotics. So hormones that are used to grow our animal-based products, pesticides that are used to contribute to our plant-based products, and looking at the metabolites of food digested, we see food metabolites, we see metabolites from even some very esoteric things. So for example, we see even evidence of mice stool in our own blood products. So we're actually consuming a lot more than just the nutrient. And I think sometimes this is where things like tomatoes may get their bad reputation, perhaps. So there are lots of benefits of green leafies, of very, very rich colored fruits and vegetables, tomatoes being one of those. But potentially the way they are grown, the pesticides they're exposed to, the environment and the soil richness that they're exposed to may contribute to some of the discordant science in this area. So that's specifically regarding to tomatoes. But if we were to look at sort of that optimal anti-inflammatory diet, I think there's lots we don't know. I think it's important to keep in mind that we eat food as a diet rather than nutrients in isolation. So when we think about things like diet, we should be possibly or probably thinking about dietary patterns rather than single foods or single nutrients. Having said that, there's lots of science, especially even in GI conditions, looking at the effects of prebiotics or the effects of vitamin D or the effects of probiotics. But I would argue we need to take a step back again and maybe not reduce our thinking so much and keep a very high level, broad overview and think about dietary patterns rather than single nutrients.
Very, very nicely put. Again, stepping back and looking at the whole. So to add on to that, you know, people are obviously, you know, diet. And if you watch the healthcare stream, it's, the non-healthcare stream, the people with lived experience stream, some of the foods that people are making and eating, I'm just sitting here starving all day. But often very healthy, and that's what the key is all about. So is there research supporting the elimination of flour or sugar to reduce pain specifically?
That's an interesting question too. So I can talk about that in the context of digestive health, but perhaps not beyond that. But in the context of digestive health, yes. So when we look at diets like the low FODMAPs diet, for which there is moderate to strong evidence for its efficacy in managing abdominal pain, cramping, bloating, diarrhea. There is evidence, or there is moderate quality, if not emerging higher quality evidence to suggest the benefits of elimination of added sugars, gluten, fructose, and these food items specifically are thought to change the microbiota in a way that can lead towards increased abdominal bloating, gas, and distension. So that's true of pain in the context of IBS. However, if we're looking for the truth, or the current understanding of the truth in terms of the food products that can affect inflammation, perhaps the prescription is not so straightforward. So I think we need an optimal diagnosis before we can provide the optimal dietary therapy. So it goes back to that, I think once we have that diagnosis, we can better understand what foods are best for what indication.
Very nicely said. I really want to take a moment to thank all three of you. It really is our pleasure to have you here, our honor to have you here. And I really hope that those people watching really enjoyed what they finished seeing. And again, there's a lot of ways to contact our speakers, so feel free to do so. I think Shelly would really like that, and that's great. Also follow on Twitter. And again, it's most appreciative every day that we put this thing together, day after day, night after night. The goal is for healthcare providers to go to work on Monday and change their practice, and for those living with pain to get something out of it that they can also bring to their healthcare provider or change at home. And you guys helped with that very much today. So thank you to to all three of you. And to everyone watching, this is your last chance to fill out your passport. The break we have to get that done now. We'll be back at 3:15. Please get your passport in before then. I think it's 3 o'clock is the deadline. So get that passport in so that we have a chance to do the draw. Make sure you do your evaluations. That's really important to us to see how we're doing and make sure we're on top of it. Get it in by 3. We'll do the draw after the opioid session coming up next. And stay tuned as we'll do movement again with Shelly. So we'll see you in a few minutes, and we will be returning at 3:15. That's 3:15. See you.